Dr. Donald.
Maya, how you doing?
I'm doing good. How have you been?
I've been well, all things considered.
You got a lot going on now.
Trying, yeah. Wife, kid on the way, and work's been killing, but a good killing. So everything's been well.
That's good to
Thank you
know.
for asking.
Of course. Now, the Daddy Issues viewers know who you are.
Yes. I'm the guy that chips in with occasional medical advice on daddy issues with Tony and Keon, and then I'm the guy that always laughs too at their jokes because they're funny as hell. So,
They're funny.
yeah.
Well, tell everybody about yourself. Where did you go to school? What are you a doctor in?
Yeah, so I grew up in Grand Blanc, Michigan. I actually grew up with a co-owner of Transit Pictures, Brendan Edwards. I went to Xavier University, Louisiana for undergrad. In New Orleans, I went to Wayne State University School of Medicine for medical school. And out here, University of Southern California for my psychiatric residency and also fellowship. And I practice general, which is like inpatient psychiatry and forensic psychiatry.
Nice. And you did your residency at LA County Hospital, correct?
Yes.
How was that?
Oh, it was awesome. I loved it. It was a patient population I really wanted to work with, more underserved, indigent communities, people that look like me, brown, Hispanic population. And so it was a good place to train. It's a good place to kind of develop your social skills, like your social work skills, because it's not only being a doctor when you're in psychiatry, but you're doing a lot of the grunt work, helping set up social services for our patients. So it was a good experience in both.
Okay. Very brave.
Yeah.
Very brave to do that.
Oh, yeah.
You know, and we need more people like you willing to do that work.
Thank you.
And you made it through.
Yeah, made it through the other side. The other side looks great. So all those people going through it right now, it's great over here. It's great on the other side. Stick to it.
Yeah, some of your people didn't make it through.
Yeah, but they went their own direction, went into other careers that are equally as fulfilling. I just knew what I wanted to be since I was in 5th grade. I knew I wanted to be a doctor. Didn't know I wanted to be a psychiatrist until med school, but once I experienced it, there was no looking back. I picked the best profession. I love what I do.
Nice. Okay, so we're filming this on Thursday.
Okay.
But by the time this is released, I will have just put out a video on morality.
Okay. Good topic.
Very interesting topic. A lot of ways to approach it.
Yes, it is.
So I figure you are an expert
Yes.
on morality, at least individual morality,
Yes.
because you work in prisons a lot.
Yeah, so I work in a state hospital full time. State hospital is basically like the highest acuity, meaning the sickest of the mentally ill in the state of California. I do that 4 days a week, and then 1 day a week I do forensic evaluations, meaning going into local jails and doing evaluations related to lawyers, asking a certain question that needs my interpretation and my evaluation of the client to be expressed in court.
Wow.
Yeah.
Wow. Yeah, you're going right to heaven. They better not even mess with you there, because no one wants to do that work.
Yeah, it's a lot of work, and yeah, I'm getting piled on today. Today, I apologize, and for all the viewers, I was a little bit late today because of work, but it's good work. It's something that motivates me to know that what I'm doing is actually helping. So I'm proud to do it. It just could be tiring at times, but I'm proud to do it.
And we were not mad that you were late, because you're actually doing important work.
Thank you.
And we're fussing around in a studio. So
No. Your work is equally as important.
No, it isn't.
Yeah.
Don't lie.
It is, because people need their escapes, especially now today, and like just the way you present topics and how thorough you are and purely objective to every subject that you talk about is helpful, and it starts conversations and it can change mindsets. So it's kind of what I do too. So to me, it's equally as important.
Okay.
Not trying to pander or anything.
You're a good liar, and I appreciate that. I really do. Okay, so let's start off these questions.
Okay.
I know it seems like a big topic, but let's just start off by asking legally and medically, what does it mean to be able to tell right from wrong?
Okay, so specifically with legally, there's a standard in California and also a lot of other states when it's called pleading insanity. There's specific criteria for that insanity plea. So meaning if someone were to commit a crime and they had a mental illness at the time of the crime, they needed 3 things in order to plead insanity. You have to have a severe mental illness. Because of that mental illness, you didn't know what you were doing meaning I didn't know that this was a knife and that knives can, when stabbing someone in the heart, can puncture them and kill them, and didn't know the difference between right and wrong. Now, legally, when they say right and wrong, they mean societal and moral standards. So in our society, we have deities, specifically Christian society, which our country is based on, is God.
Mm-hmm.
So if you're doing something on behalf of God and you felt that morally you were doing the right thing, for example, God told me to barricade the doors and drown my baby, because if I didn't do that, the baby wouldn't get into heaven. And you truly believe that because of a delusion. You could file the insanity plea and potentially win because you were doing it for a morally right reason that was above society standards. God is above society. He's the moral center. But if you're doing it on behalf of Satan, which society views as evil, you couldn't file the insanity plea because everyone in society knows that Satan is bad. So if you're doing it on behalf of an evil entity, it's considered wrong.
Now, I agree with that, me personally, but legally, I don't know how you could make that argument because we have no preference for religion.
Yeah. So that's the thing, and that's where it kind of gets tricky. So when we're evaluating someone for an insanity plea, of course, we look at what the events that led up to it, but you look at history. You look at, okay, they've had this diagnosis. They've had this mindset for a while. They use the same consistent deity. Afterwards, even after treatment, they might have realized what they've done and or still stayed in the same mindset. It was something consistent. The thing about the society standard is that that's what we have to base it on to make this plea, because if we just kind of made it inclusive, it opens up to interpretation and can basically open the floodgates for a lot of people saying, oh, I kill in the name of
ancient Egyptian deity.
Yeah. Exactly.
So you couldn't say I'm killing in the name of an ancient Egyptian deity. See, that's still, I can't get behind that.
Yeah. So I've never seen it personally. I mean, sure, depending on the lawyer, depending on the evaluator, maybe you can say that this deity and kind of give the history of this deity to kind of explain how it's morally right to this person, because it could potentially be culturally specific. But then again, you got to convince a courtroom. You got to convince a judge. You got to convince jurors. And what do judges and courtrooms and lawyers all know? Everyone knows God, because we live here in America. So it's easier to use that deity as opposed to someone probably lesser known. Mm. So again, it's based on society's version of morality. It might not be right, but if you're a good lawyer and a good evaluator, you can probably present a case where someone like that or something like that can be considered morally right. You just have to give context and kind of give the history of that deity to kind of explain to the court how, in that person's culture, it's considered morally right.
That is fascinating.
Yeah. Just extra legwork, but it can be done. I personally haven't seen it. It's just easier to say God or Jesus or any of these other official figures that our society knows the best.
That's really interesting. That's probably going to have you back just to talk about that. Yeah. Because define God.
Yeah, that's true.
Say it's not raw. You know what I mean?
Yeah.
It's just, God is very vague.
Yeah, that's true.
Okay. We got to
Yeah. Look it up. Yeah, for all the viewers, look it up. Yeah, that's the standard. The insanity plea. It's very hard to prove. Actually, 1% of people who use the insanity plea actually are successful. Mm-hmm. So very rare to use that plea and very rare to actually successfully win it, because you have to prove all three of those things at the time of the crime. And it's very hard to do.
Okay. So if somebody is mentally disabled, can they not tell right from wrong because of their disability?
No, they can't.
Okay.
So the thing is, when you can tell right from wrong, you know that what you're doing can get you legally in trouble. So I know if I were to stab, like a better example, you, and I happen to fear for my life or something like that, then I know that if I stab you and potentially hurt you or kill you, that I could go to jail. And I know society's punishments for that situation. If you truly didn't know, then your actions wouldn't follow it. So, for example, if I were to stab you and I was out of my mind, I wouldn't try to help you. I wouldn't try to hide the knife. I wouldn't try to run, because if you did those things, you know what you did is wrong. So your behaviors have to match the actions. Mm-hmm. If you're a person that, I stabbed you and then I'm sitting here doing the podcast alone covered in your blood and I'm just sitting here for days, maybe not even eating or anything, and then the police come and find your decomposed body with, sorry, this is getting dark, but find your decomposed body and me covered in blood, I'm just sitting here, then that would basically say you don't know what you're doing because your actions don't follow that.
That's really interesting. So in psychiatry, do you deal with what a conscience is?
So in an abstract manner, yes. My day to day, when I'm working an inpatient and I have like the patient population I deal with, it's more so medication management. There is some therapy that I deal with specifically, but it's mostly my staff. When I say staff, psychologists, social workers, rehab therapists, rehabilitation therapists, which is like recreational therapists, all those things we use for treatment. But when we're talking like abstractly and I'm like getting into these deep conversations, because some of my patients actually like to have those conversations to kind of bring up their history and kind of like put it into context, then I talk about conscious, I talk about choices you can make, I talk about influences, your upbringing, and kind of tying that all into like, oh, maybe this is your conscious and not necessarily an auditory hallucination. This is you talking to yourself, like a voice in your head, instead of like an external voice talking to you, like you can hear through your ear instead of in your mind. So that's when I talk about conscious.
Okay. So now that's really interesting. And this is probably going to get cut out because it's a really weird question and it wasn't what I sent you.
Yeah. Let's go.
Okay. Have you ever got like a patient who says something was talking to me and you came to the conclusion that it wasn't themselves talking to them? Or you were ever like, oh, that's weird, and then just walked away, which is what I would do.
So a lot of my evaluations are based on that. So what I do mostly, just to give a little background, I do competency to stand trial. So if someone were to commit a crime and mental illness had something to do with it, or in the course of the trial, they didn't know what was going on because their illness was stopping them from understanding or working with the lawyer, they would call me to see if that's the case. So sometimes I get people who are malingerers, meaning people who lie for secondary gain. If you're a person facing 10 years in jail, I would lie and say, oh yeah, a voice told me to do it, and then go to a hospital instead of general population where you have a single cell, you get more treatment, you get more groups and things like that. It's more cush compared to being a general population. So I would do that too. So there's times when I'm evaluating someone and they're saying, oh, I'm hearing voices. Oh, tell me about them. And I just keep open-ended questions. You hear them every day. I could tell you how mine sounds every day. I could tell you specifics. I could tell you, oh, she sounds like this type of person. Here's her voice quality. This is the content. I could tell you that if I heard it every single day. Sometimes people lie, and you can tell when they're lying, and you can tell when they're not. And it's just based on experience. The liars would basically say, oh, yeah, I'm hearing them telling that there's aliens in the sky and yada, yada, yada. And they're able to distinguish the voices and just lead, oh, yeah, I'm hearing voices. But someone who's truly psychotic or schizophrenic, first of all, would be distrustful of you. Who are you for me to open up to you fully? So they might try to hide it. They might try to show and put on a good face. And then in the middle of the interview, they might like look around, or they might not hear what you're saying. You have to repeat the question. Because someone who's truly schizophrenic, it's like someone whispering in your ear right now while you're trying to have a conversation with me. You can try your best to listen, but you might miss a couple words here or there, sentences. So you can tell those things with the interaction, their body language, how they respond, stuff like that. There's some good actors because we are in California, but there's some ways and there's some questions you can ask to kind of get around that too. So it's all based on experience, and it's operator dependent. So every psychiatrist is different in how they elicit who's lying and who's not.
For the truly schizophrenic people, what is the voice that's talking to them?
So it varies, but a voice that's usually talking to them, sometimes it could be dependent on mood. So if someone's really sad or really manic or really anxious, the voice kind of corresponds with that, and that usually speaks to the severity of the mood. When I say mood, like depression, bipolar disorder, stuff like that. So if you have voices that correspond with those mood changes, that means it's more severe versions of that mood disorder. So sometimes it could be that family member who's always harped on you, like mom or dad or a cousin, or someone said, you're ugly, you're not going to make it, things like that. And it's more mood congruent. So if you're sad, it's the voice matching it is sad and kind of piling on. Then it could be that. Sometimes it could be a truly unknown voice. With those, it's kind of different because when people or patients say unknown voice, a lot of times it's a voice they do know, but it might just be buried deep down and they don't know who it is. It might be a voice they heard on a commercial or something. There's no such thing as like an unknown voice. But a lot of times it could be a family member or someone who could be close to them or someone who has done them wrong in the past.
Man, that is really interesting. Because in other cultures, these schizophrenic people might become shamans.
Mm-hmm. Yeah. So with that actually goes into a whole nother topic, personality disorders. So a lot of people, and I don't know if you want me to go into this. That's fine.
Go.
Okay. So personality disorders are basically impairments in any functioning of your life. When I say any functioning, social, occupational, interpersonal, between other people, with strangers, with family, financial, legal, constantly getting arrested. And it's something that's egocentric, meaning beneficial to your ego. So you see nothing wrong with yourself in order to change. So I'm going to keep being me, essentially, because why? It got me this far. I'm not going to change. And it's basically a pattern of beliefs, thoughts, and behaviors that are persistent and usually start in early adolescence and is diagnosed around mid-adolescence to like early adulthood. So probably around your teens to early 20s. So you have to have this set criteria of, there's 10 different personality disorders present at that time. The reason it's that time is that's usually the time your personality develops, usually around mid-adolescence. So an example of a personality disorder is schizotypal personality disorder. So what you're describing as a shaman, a lot of times schizotypal individuals kind of fulfill that criteria. Schizotypal means you kind of have odd, eccentric beliefs, odd behaviors. So like people who feel that they can read minds or telepathic, or I had a patient who was schizotypal who lived in a commune in Malibu and felt that he or she, because I'm not going to diverge who it was, he or she could communicate with other people in the commune.
Could they?
Yeah. She felt that they could.
Did other people say that she could?
Other people in the commune said that they could. And she had this fervent belief. And I didn't want to challenge it because when she was in the hospital, or he was in the hospital, it was for like other things. So it wasn't something I needed to challenge at that time because she came in inpatient. So I just was interested and wanted to know more about it. But yeah, they had that belief in the commune and she still had it outside of the commune. So I thought that was pretty interesting. But it's basically odd, eccentric behavior. You have a specific communication style that kind of gets lost with others. So like when I'm trying to like communicate like these weird, odd behaviors to other people who don't believe it, they're like, oh, you're weird. And like you're kind of shunned by people. So what we see in our society as schizotypal are like fortune tellers, shamans, those type of individuals. People with schizotypal personality disorder actually have the highest risk of developing schizophrenia later on in life. So that's the one personality disorder that can lead to the development of schizophrenia organically.
You know, with that lady who thought she could communicate,
Yeah.
I would test her.
Yeah.
I would just see, I would see if she could send the signal. Like,
Yeah.
what card am I holding up? I would see out of 10.
Yeah.
Does she know?
And some people try that. Some people try them. And when that happens, it can be met with resistance. It can be met with anger when it's not right. Or, it's like, oh, you're not a believer anyway. That's why it didn't work. So it can be met with denial, excuses, things like that. And they'll just keep along their way. It's not really going to change them. All it's going to make them feel is reinforce like, oh, this is just the world who hates me. They don't believe in me. And let's keep it moving. So.
Yeah, I'd have to see, because if everyone else is saying it,
yeah,
who am I to say no?
Exactly.
And like you said too.
Yeah.
You said, who am I to challenge this belief?
Yeah, unless it's something that's potentially damaging to one of those realms that we talked about, interpersonal, legal, getting arrested for your beliefs, all that stuff. Then I would challenge it in that situation. Like, do you know you're thinking your way of life is kind of interfering you legally? You have felonies. You have all this stuff. Like, you're in jail right now. What can we do to kind of help through this stage? That's when I would address it, when it became that way. Otherwise, be you. Be who you want to be. As long as you're not hurting anybody, you're hurting yourself.
Now, that's true. A lot of people go to psychics. A lot of people go to fortune tellers. Yeah. And here, it might be a little odd, but in Romania, perfectly normal.
Yeah.
So
It's based on society.
Based on society.
What we do here is probably weird to them over there. Some things we say are the standard or whatever. So it is based on society, what we deem normal and what we deem odd. And I even tell my students with schizotypal, like, things that used to be odd back in the days are now normal.
Mm-hmm.
Women wearing brightly colored hair in professional settings, they used to be odd. The way we dress used to be odd. So it morphs with society. So, as doctors, we got to be aware of that and know and like kind of move with the changes in society. Otherwise, we're misdiagnosing people. And we've been seeing that sometimes, saying people are schizophrenic when in actuality, they're not delusional.
Mm-hmm.
Specifically in the Black community, and I know that's a whole nother topic.
If you can sum it up, or if you can come back at some point, okay, then we'll address that because I want to know what you're talking about.
Yeah, just basically when I say delusional, delusions are fixed false beliefs that even when presented with evidence against that belief, you still believe it.
Mm-hmm.
So what used to be viewed as a delusion in the Black community is like police are out to get us, trying to harm us, trying to kill us, and like I have to have like a PTSD like presentation. I have to be always on my toes, hyper vigilant. I'm avoiding the police. I'm running every time I see them. This happens in my community, and then mostly white psychiatrists are evaluating these people and saying, "Oh, they're delusional, or they're really impulsive, and they're really fearful of entities that are just there to help them. So they're schizophrenic. Let's put them on an antipsychotic. Let's hospitalize them because schizophrenia is overdiagnosed, especially in Black males, instead of bipolar disorder, instead of anxiety disorder, instead of ADHD, instead of PTSD. So we're jumping right to the big diagnosis and then the stigma that comes with it, and it's a whole trickle-down effect. So it's something that I try to educate my students about. Cultural sensitivity and just knowing the societies that you're working with is equally as important as knowing the diagnoses and the criteria of each diagnosis. So you have to do your homework.
You have to do your homework.
Yeah.
If there's a psychiatrist listening, just play that part back.
You have to.
Contact Dr. Donald because you don't want to mess up. That seems like a pretty big mistake.
Yeah, huge. And the psychiatrists are basing it off their own culture or their limited experiences with that culture that they're evaluating.
Yeah.
So, yeah. I try my best. I have shortcomings too. I'm not perfect, but I recognize that I need to get better with that too. But everyone does.
Yo, if you were going to go to Cambodia and start working as a psychiatrist in Cambodia, you would take the time to live there for a little bit and see what's going on.
Exactly.
Before you start diagnosing people.
Exactly. 100%.
Something perfectly normal, to them might be schizotypal to you.
Yeah, exactly.
So that is really interesting.
Yeah.
Okay, so back to this conscience thing.
Okay.
Is being able to tell right from wrong the same as having a conscience?
I would say yes. In the fact that I believe the conscious is a combination of the id and the superego. And those are Freudian principles, and that's a whole thing too. So I'm going to sum this up in probably like 5 minutes. So there's 3 parts of the human psyche, as suggested by Sigmund Freud, who's like the father of psychology. The ego, the id, which is ID, and superego. The ego is basically your identity, who you are as a person, your beliefs, your behaviors, your culture, the things that make you you. If I were to ask who is Maya, this is what Maya would say. This is what I would see in Maya. This is the behaviors of Maya. This is her beliefs, everything. That's your ego, your identity. Your identity is formed and influenced by 2 things. Well, 2 major things in your psyche, your id and your superego. Your id is basically the unconscious desires, almost primal desires that every human has since birth. It's unconscious in the fact that we can't control it. When I say primal desires, that's like sex, violence, hunger, all the things that we want to fulfill pleasure with in order to like get instant gratification. The superego is basically your morality. That's developed as a kid, as you get older, and hopefully it's developed by whoever's raising you. A lot of us, well, not a lot of us, but some of us, it would be our parents, our role models. If you don't have those things, then whoever is raising you, or if you don't have that, then you won't really have a firm superego. And that's basically your morality center. That's basically like the voice in your head, don't do that. You're going to go to jail. That's 5 to 10. Or like, these are the consequences of your actions. It's kind of like the nagging voice in your head. So, lack of better words, the cartoon devils, the id, the cartoon angels, is the superego in the normal cartoons, and then you're in the middle. being influenced by those in certain situations, and they just come up out of nowhere. So both of them have an influence on your ego, who you are as a person.
That's really interesting. I feel for a lot of people whose parents weren't there all the time, like Carl Winslow
Yeah.
is their super ego.
Yeah.
Because,
Exactly.
yeah.
Exactly. 100%. Because the thing is, it's like, who's there consistently? Who's there to kind of like, oh, I've been in that situation, that Urkel or what's Carl Winslow's son name?
Eddie.
I've been in that situation Eddie's been in. Let's see how Carl reacts to it. Oh, okay. That's a dope ass lesson. Thanks, Carl. Yeah.
Or Uncle Phil.
Uncle Phil. Yep. Exactly. So some people latch onto that, and it's like something that's, develops your morality. And if you don't have that, then you're going to seek it from the world or just negate it altogether and kind of succumb to the id or succumb to other influences in order to develop your sense of self, your own morality. Some people don't have morality either. When I say don't have morality, meaning a moral center, meaning they kind of thrive off their own desires and what they want for gratification instead of adhering to what's right or wrong in their own like moral upbringing. And I can go into detail about that too if you want.
Yes, please.
Okay. So that's when we get into like the talk of like someone being born without emotions or without a conscious. What I mean that is like a psychopath essentially. So a psychopath is someone, and I know we had these talks and I actually misspoke about one element of the talk that I'll clear up right now. So a psychopath is someone who understands emotions, who understands morality, but they just don't feel it. Like they don't have that super ego kind of driving them to say, oh, that's right or wrong. They just know that it's right or wrong, but what society tells them, not what they're telling themselves. What I mean by that is they might be people who know what an emotion is. They know what happy is. They know what sad is. They can mimic happy or sad, and they kind of put on the mask in order to get through life, to get through society. So psychopaths can be those people who are manipulative, who can put up a front, essentially, and they're very meticulous in what they do because they know this is what's wrong in society. This is what they say the consequences are. They don't care about them, but they're going to do what they got to do to kind of move forward through society. So they're aware of it. They're just not motivated by an internal struggle of morality. They're just like, I choose not to get in trouble. I know there's the consequences of getting in trouble. Let me just do this. So an example would be like in Dexter. He would be a psychopath. He's like textbook psychopath. Have you seen that show?
I watched the first few seasons. It started to fall off toward the end, but
Okay.
I watched those good
Well, you
seasons.
watched the important one. So basically, he knows what emotions are. He had a code, and that's what his dad taught him. His dad was basically instilling this code in him, like, Dexter, I know that you want to kill. I know you want to fulfill the desires of the id. This is how you do it and not go to jail for life. You become a blood splatter analyst. You put on a good face. You kind of hide in the background. You follow the rules. You have a girlfriend. You have a wife. You have an alibi. You set all these things up, and then you kill who you want to kill. This is how you dispose of the body so you don't get caught. And then you go about your day. So you're fulfilling the desires of your id, which is unconscious and will be there, but you really don't have the ability to feel emotion. You know what it is. You can mimic it, but you don't feel it. You're not driven by it. So he was kind of a psychopath in that matter. And the way the show progressed, he started to develop emotions, and I was like, I get it. But the whole show did a great job of explaining like what a psychopath is. And it's different than a sociopath.
Okay, so yeah, what's a sociopath?
So this is where, when we had the conversation, I was doing more research, and I actually messed up on that one part. So a sociopath is someone who is driven, who knows what society is, who does have a moral, can have a moral compass and like have those relationships with people and like kind of develop that super ego, but it's not as strong. So for some reason, they just hate society. They don't like, and that could be due to their upbringing. It could be due to just negative experiences. But in the end, they just want chaos. They don't really care about stability. What I mean by that is someone who's a true sociopath might go out there. They might have a couple friends. They might have a couple relations, but then they'll disobey the law, or they'll get in impulsive fights without thinking, or they might be in a job for like a week or two and then they sabotage it because they don't like being around other people. They know what it is. They have emotion, but their emotions are like very quick and intense and impulsive, and they just don't like being around other people. So when they these are people that actually do commit crimes. These are people that do get caught, and these are people, a lot of them end up in jail, or some of them end up in, excuse me, not really jail, but like are kind of like shunned by society. So they might band together and kind of work together and make, these are like I wouldn't say like
a villain group?
Like a villain group,
like
but I don't want to.
Suicide Squad?
Kind of like, we hate the world, so like I would say like incels, but not really, but like kind of like that type of situation. Like, we're blaming society, so let's tear it all down. We don't like the way the world is because of our negative experiences in it. We have other people we can't connect with. We do have emotions, but they're just so unstable, and we don't like this framework that's put up around us that we have to be in. Sociopath, they hate society. It's pathological, it's dangerous, and some of them choose violence as their means of resistance. But some people have sociopathic tendencies, some people have psychopathic tendencies, but they're not prominent lawbreakers like you would think. Some psychopaths don't break any laws and they live healthy, fulfilling lives as CEOs, politicians, things like that, get things done. Some sociopaths are out there. They might have frequent jobs. They might be some of your friends, might be some of your family members who just don't have that core group of friends, might piss you off one day in an argument or whatever. But sociopaths are more destructive, more in jail compared to psychopaths.
Really?
Yeah.
So do you think, off of what you were saying, as they use any excuse to act out their misanthropic beliefs.
Yes.
Do you think this past summer of 2020, there were some of those hiding in the crowd?
Mm-hmm. I do, because now we have I would say sociopath, well, past sociopath, or a person that was promoting sociopathic mindset and saying, it's okay, come out, do what you want to do. We're running the show now. And so all the sociopaths went out there and did their thing, whether it be on either side, but in my opinion, one side more than the other. And then you get all this, this destruction, and let's tear it all down. And, whatever way you lean, I mean, that's what happened in our society. A lot of constructs that were up a year ago are now down or weakening. And so we're having to reflect as a society as, where do we go from here? What do we do from here? So
that's interesting. I know in the town that I grew up in, Providence, they had a...
Oh, Rhode Island?
Providence, Rhode Island. Yeah,
I didn't know that.
Yeah, I was born in Boston, but we grew up in Providence because my mom went back to university
No.
when I was about 7. So she went back to get her master's and then doctorate, so that's where we grew up. But there was a protest called, and it didn't start until like 11 p.m. And so I was like, this isn't a protest. They just came and they trashed the town. And they said it was because they were against fascism and they were for Black Lives Matter. And it was mostly just, white kids trashing stuff. And I said, this has nothing to do with Black Lives Matter.
Yeah.
Black Lives Matter is not marching at midnight through the downtown, smashing up things. So
yeah.
I look at that and I'm like, there's nothing worse than you can do. There's nothing worse that a person can do than take upstanding ideology, whether it be Christianity, whether it be Black Lives Matter, whether it be, whatever it is, whatever religion it is, and then turn it on its head to do something evil with it.
Yeah.
Because then people turn away from the initial thing to begin with.
Exactly.
They blame Christianity for these sociopaths going through and causing harm.
Mm-hmm.
They blame Black Lives Matter for these people causing harm, not the term, but the organization, or not the organization, but the term.
Mm-hmm.
And then they say, well, other people say, well, see, this is what they represent. It's like, this is not anything that anyone ever represented. These are certain people who just happen to be on this team,
yep,
using it for their advantage.
Exactly. That's perfectly said. Yep. That's what it is. It's the sociopaths kind of ruining for everybody, or the goal of the sociopath might be to tear down that ideology, like you said, in an effort to just, fulfill their own gratification, or to tear down the ideology as a whole, because some sociopaths just don't like society. They don't like constructs. They don't like certain things. So let's just tear it all down.
Haters. So what's the difference between a sociopath and a hater then?
So I would say There can be some differences. I mean, haters. I mean, when you hear the term hater, I mean, it could be behavior, it can be verbal, whatever. Like you're hating in their face, hating behind their back, but it's mostly verbal. A sociopath is usually going to do something physical with their hate, but not always. I would just say sociopaths, like, if there's a spectrum, hate would be a little bit less than sociopathic as far as the outcome of the behavior. If you're hating on somebody, yeah, you'll say it, or you might try to tear them down verbally, or talk behind their back to their friends or whatever. But I mean, there's haters out there that I wouldn't say would destroy things like to that nature.
Well, that's interesting because you deal in prisons.
Mm-hmm.
So you deal with mostly men, correct?
Well, I do see some females, but yeah, mostly men.
Because the way women, and I'll have to do a video on this, the way that women use aggression is different than how men use aggression.
Psychological.
Yeah, women are a little sneakier about it because they know, they don't want to get into a fight. There's a good chance that, especially if it's against a man, that they'll lose, or if it's against another woman, they might lose as well. And plus, it's tacky.
Mm-hmm.
The way women do it is they destroy your reputation, they talk behind your back, maybe they'll make a phone call here and there.
That's true.
But it's still violence. And of course, there's the poisoning, there's the manipulation, there's just different ways. And sometimes it's really hard to spot a female sociopath. It's really hard to spot them.
That's true. That's a good point.
Yeah, especially if someone just stops talking to you and you don't know why, and you don't know if someone's been tarnishing, your image. Mm-hmm. I met one long time ago in high school. This is in Pakistan. And she told me one time, she's like, anything you ever have to say, you can tell me. I'm an honest person. And then someone else told me, they're like, she talks behind your back constantly. So she was really deliberately trying to get information to then use against me.
Yeah.
And I was like, wow, I would never even think that someone would do that. But then, I think I was in my early teens. And I was like, oh, okay. This is what you have to watch out for with other women. Yeah. Not most of them. Most women, I don't care what anybody says. Most women are fine. It's perfectly fine to have female friends. This is not most women. This is just a very small sliver of, say, mean ones? The mean ones with mean streaks?
Mean girls, essentially.
Yeah. And
why do you feel she did that?
I don't know. I think we were the new American kids, and so people were more interested in us, and they were paying more attention to me and my sister. And I think that maybe she just had a mean streak. Like, legit. She just was a mean person who was damaged, and the way she asserted herself was to take other women down, especially in that society. You're not going to do anything with the men because it's very separated. And she was Pakistani, but she was born in the United States, so she was very Americanized.
Okay.
I don't know. Sometimes I think about her, and I'm just like, you never know when something like that, one of those, is around.
Yeah, you never know because, like you said, she was Americanized Pakistani. Maybe she was seen in a light before you came, and people were hating on her.
She had a reputation.
Oh, okay.
But
you think she brought it on herself or something?
Oh, yeah, but I mean, the way it is over there, anything can get you a reputation. You wear too many, T-shirts. And instead of shawakamis, you get a reputation. If you have a boyfriend in high school, you get a reputation. It's like the stupidest things will get you a reputation.
Wow.
Yeah, so I never cared. I'm like, whatever, girl. You, like, legitimately, you can talk to me and I will not judge you. Like, it's whatever. But it wasn't that way, the opposite. That kind of taught me a really good lesson. That just because I'm here, like, open and honest and trying to support everybody, everybody's not like that.
Yeah.
Even if they present themselves as such.
Yeah, that's true. I mean, sociopaths can teach you a lot of lessons in life.
Yeah, sociopaths, that's really interesting. I do have to do a video about how women can be aggressive, female aggression. And they also, they'll do things like, I would never, but, they'll do things like maybe get their husband fat or poison their husband in certain ways slowly, and poison their children. This is extreme when they start poisoning their children. But, just to encourage their girlfriends to eat badly so that they can say, oh, she's getting heavy. Just little things like that.
That's terrible.
Like, oh, I I see. I see.
Slow burn.
But it's interesting. I mean, it's as a creative person who writes a lot, who does a lot of the writing, I wouldn't have a lot of characters if there weren't, these traits in people. And I'm never gonna talk down on women either. So most women are not like this.
Yeah.
Most women are not.
And the thing is, like, people can develop, like, all this is developed early adolescence. So if you're in a situation where you're trying to learn yourself and learn who you are, and you develop that one great relationship that's like, oh my gosh, I really love this person, but that person betrays you, then it's just like, man, fuck everything. I'm done. And that could have been the catalyst for her behavior, and it just affected the way that she dealt with everyone who possibly looked like you or in a similar situation. Maybe you reminded her of a friend that she had that fucked her over. Who knows? So you got to catch it early, because that's the only way you're going to deal with it. Because people who are sociopaths, when I say sociopath, antisocial personality disorder, which is a different one, the prognosis is actually worse the later you catch it. So if you catch someone in their 30s or 40s with this personality disorder compared to earlier, then it's going to get worse. You're really not going to be able to do a lot to fix them.
I see. So I was reading about this man called James Fallon.
Yeah.
James Fallon, he's a neuroscientist.
Okay.
And Fallon. Ooh. Fallon. Is he like Fallon? Yeah. I guess
like
it's
Jimmy Fallon?
It sounds like Jimmy Fallon, but his name, this is not Jimmy Fallon. I looked him up.
Okay.
It's not Jimmy Fallon. But he's a neuroscientist, and he was going through brain scans, and he found that he had the brain scan of a psychopath.
Interesting. Yeah.
Yeah. So is that inborn? Are you born a psychopath and you become a sociopath?
So yeah, you're usually born a psychopath. And they have, like you said in those scans, like they found like white matter changes and different densities in certain parts of the brain, specifically the frontal cortex, which is also the temporal lobe, which is the areas of like organization, executive functioning. Temporal lobe is like your areas of like emotional memory and emotions. So people who are psychopaths usually have like that id kind of develop. Everyone has like they call it undifferentiated id as a kid. As a kid, all you care about is feeding, eating, shitting, stuff like that. And then as you get older, you start developing relationships and bonding and things like that. So someone who's a psychopath, they might stick more to themselves. They might they'll be able to go with the motions as they get older and maybe have friends, but they're like really superficial because it's like, I don't really connect with anybody. It's almost like you're on the spectrum type mindset. Like you like what you like, you do what you got to do. You're always in the mood for, I need to be gratified in some way, but you know the rules of society, so you don't want to violate them. You don't want to be seen as like an outcast. You still want to like further your gratification. So you're going to do what you got to do. You might develop superficial relationships. You might, go through life and do these things. Some psychopaths are very successful because they know what they got to do, keep their head to the ground, grind, develop these egos, these personalities that draw people to them, bring them money, bring them clout, things like that. And then they're just building up their image, building up their companies, whatever, with the whole goal of gratification. It's not looking out for them because I don't care about other people besides myself. So all I care about is winning. I care about like general concepts, winning, being rich, things that pleasure me. And I'm going to do what I got to do to get that.
Isn't that all of modern society?
Yeah, but some people like won't cross that line. Like I'm not going to, if I know what I'm doing is going to hurt someone else's situation, I won't do it. Or I might do it behind the scenes if no one knows it. But psychopaths are, I'm going to do what I got to do, and hopefully no one finds out, but I'm going to do what I got to do. I got to do it because I got to get to this goal. That's my goal.
I don't know. I mean, we're in Hollywood, so what you just described is normal behavior.
Yeah.
So how does it differ from normal behavior? Is there ever going to be a day when people just say psychopathy is no longer a mental illness because it's so normal?
That's a great question. We don't really know how prevalent it is because the thing is, like, to know how prevalent it is, you got to do a lot of, like, I know you mentioned there's a psychopathy rating scale called the PCLR, Hare psychopathy scale. It's like a very long quiz, and it's like it deals with like sociopathic tendencies. There's different checklists, manipulation, disregard for the law, emotional lability. It's like a bunch of different areas, and you rank it like on a zero. I think it's 0 to 2 scale, and you add it up, and it's very reliable. Meaning, like in between people, like if you get a certain result, it's usually the same thing, and it's usually positive or negative. So they have specific scales dedicated to this to see if you are a psychopath. And there's classes you can go through to administer the test. Actually, today and tomorrow, there's actually a seminar by the Dr. Hare, who's a psychologist, Hare, who made this checklist. And it's really interesting. We learned about it in forensics because that's what they use for the insanity plea sometimes is if someone's a psychopath. It's very interesting. If everyone took this checklist and went through it and we added it all up, then you can see.
Oh, that's interesting.
That's the only way. Because otherwise, they're good at hiding. They know the role. They know the ropes. They know all the emotions. Sometimes they can mimic them, and behind the scenes, they're doing their own thing. And the thing is, they're very meticulous, so they don't get caught because they know the consequences.
Yeah, this particular Dr. Fallon, he didn't know he was a psychopath until he saw his brain scan. So he just knew he was a jerk. He'd always known he was a jerk his whole life, and then he saw his brain scan. Because he has access to it. And he's like, oh, that's why I'm a jerk. I'm actually a psychopath.
Mm-hmm.
So he called himself a pro-social psychopath because he was raised well. He had a good super ego.
Mm-hmm.
But, he didn't know. So I wonder if there are people watching out there who are thinking, wait a minute, am I a psychopath?
It's possible. If you were ever in a situation where something truly hurtful happened to you or happened to a loved one, and you're just like, yeah, you mourn for a little bit, but then it's like, just another Tuesday, and you keep it moving. That's kind of a sign. Not to say that you don't care, but it's something that really doesn't affect you that should affect you more. When I say more, like affect your day to day, like I can't go to work the next day. My mom passed away. I can't go to work. I can't do this stuff. In actuality, and this is not just this. I'm just generalizing. I'm just as a terrible example, but like a psychopath would be, oh yeah, that sucks, but I'll just use what I learned from mom and the code I learned from mom and just keep it going and just further that goal. But it's not about the bond you had. It's not the relationships. It's not all those things.
So, okay, that's good to know because when my mom passed away, it messed me up for years.
Yeah.
Messed me up for years. So at least I know I'm not a psychopath.
Yeah. So you have empathy. So psychopaths don't have empathy. They're not born with it.
Even toward their children?
Well, and that, I can't really, so you're not, I'm trying to answer this question. So like, you're not born with it, meaning you don't feel it, but you know what it is. So like, like you might develop some sense of it, but it's not to the level that you need it. So it's like if something happens to your kid, you're going to be concerned. You're going to do everything a normal parent would do, but it's not going to deter you from your goal. You're still going to go back to work. You're still going to do what you got to do. It's not going to weigh on you. It's not going to be like, man, my kid's really hurt today. Let me leave work and I don't care what losses I take today. I got to look out for my kid.
Mm-hmm.
Like that might not happen. But someone who's empathic, it's going to affect their day to day. Like, man, I'm really worried about my kid. Let me call, check in on them frequently, something like that. Like showing steps where you want to put yourself in that person's shoes. And if you're in your kid's shoes, man, I really want my dad here to kind of support me or my mom here to support me. So you're thinking of that and you're trying to fulfill that. Someone who's a psychopath is like, hey, I'm going to go through the motions. Like, I'll be here. I'll make sure they get the best medical care. I'll make sure all that stuff happens. But besides that, I do what I got to do.
That's really interesting for me. Okay, so someone who goes out for a carton of milk and never comes home. Is that a psychopath?
I would say, yeah. That's pretty psychopathic. Because you're putting yourself before other people. You're not even considering the kid. You're just thinking of your own situation. But at the same time, there's certain people, and they'll try to justify it, make excuses for it, saying, I wasn't ready to be a father or a mother, and I just had to leave and gather my thoughts. And my whole mindset is I was going to come back later when I had everything together, yada, yada, yada. It's all lip service. Chances are they weren't thinking about the family. They weren't thinking about the kid. But it's all situation based too. So I can't say that is for every situation. Maybe mom was toxic. Maybe other stuff to kind of like really make it unbearable to be around that situation. But at the same time, you're going to have some involvement. I know, there might be situations where baby mamas or baby dads have a terrible co-parenting situation, but you're going to do what you got to do for the kid. You put yourself in the kid's shoes. You made this kid. You're going to be there for the kid. People that just flat out leave, possibly more psychopathic.
Yeah, because I'm just thinking, this is 2021. How are you going to look at your kid and say, I'll be back in an hour? And then full well you're never coming back and you're going to leave them.
It's so fucked up. Yeah. We all know people like that, unfortunately.
Yeah. Yeah, there are people like that. Well, honestly, if I knew a person did that, I would probably shun them. I would probably shun them from the group and just be like, I don't want you around.
Yeah.
Just because you're too dangerous. That person is a little bit too dangerous you don't know what they can do. They're like a loose cannon. They could do anything,
Exactly.
So I'd be like, oh, okay, we don't invite you to anything. You're gone.
Yeah. Because you never know. You don't know their intentions. You don't know anything about them. Why are they, if they can do that to their own flesh and blood that they made, they don't give a fuck about you. They don't know. You don't know what they're going to do to you.
Yeah, they don't care about me. If they don't care about their own kid, they don't care about me.
Yeah.
It's too dangerous.
Mm-hmm. Unless you're a means to an end, and then they'll superficially care and go through all the motions to care. And as soon as they got what they want, hey, Ma, I'm about to go. I know we co-own the studio, but I'm about to go get my metaphorical milk.
Yeah.
And leave you out here to dry because they have another opportunity that's bigger and better because you already helped them get to where they need to be.
Yeah, and that's Hollywood, so.
So yeah, it might be a lot of psychopaths out here.
Yeah.
Might be.
So my question was, how do we know if we're psychopaths? We can't get a brain scan. We go do this PCLR hair psychopathy scale.
Yes.
And check that out.
Yes.
Now, I just read that book over there, The Sociopath Next Door. This is why we had the initial discussion, because I was reading this and I was just like, there's 4%. What are you talking about? She talks about it like they're under every rock and they could come out and get you and, But it did make me think, like, okay, there's a reason why these certain people, this book is by a woman named Martha Stout, PhD.
Check it out.
Yeah. It's a quick read, but she said it was 4% of the population are on that scale, the sociopath to psychopath scale.
Mm-hmm.
And so that's actually 1 in 25. That's not nothing.
Yeah.
That's something to look out for because we know, they say 150 people. That means we know at least 6 of them. Probably in my life, I've probably met 10, I can say, or somewhere just off of 1 or 2 things they've done. I'm just like, And
you just don't care because the thing is, you do something like so vile, and I just see on the back of the book, it says your sadistic high school gym teacher, your lying, cheating ex-husband, your boss who loves to humiliate people in meetings. Like, we all know someone like that, and some people chalk it up, oh, they're just having a bad day. But like, if you can get to the point where you're doing that and it's just like you have no regard and you don't apologize or anything like that, you just business as usual. Yeah, that's a sociopath. That's terrible. It's terrible. You just have no regard for other people or what that humiliation can do to them long term, because there is long term ramifications, whether that be towards the person doing it, like a hostility you're building, or like something that can lead to something, or just, who knows with the relationship in high school. Like, high school is prime development years, and you're doing that, and the kid is dreading going to school, and then they become depressed, substance use, all this stuff. Like, you got to be cognizant of that, and you have to care about it, but some people just don't.
Now, in your day-to-day, knowing full well and dealing with these people, do you keep an eye out for destructive mental illnesses when you're...
100%. I have a couple... Well, I had and have some people on my unit. I have a 28-patient unit. So most of my patients stay long-term. When I say long-term, months to sometimes years, because we're waiting on placement and we're waiting to kind of like get them to a place where they're able to move to a lower level of care. So whenever we get a patient who's kind of destructive on the unit, when I say destructive, like destructive with relationships, might start fights or start shit for no reason, and it kind of trickles throughout the rest of the unit. And the thing is, it's a long-term unit. So we tell the patients, like, we have to set rules. That's what you do with someone who's sociopath. Limit setting. These are your consequences. These are your rewards, things like that. So we have to have consistent rules, because then they'll try to find the cracks in that. Oh yeah, this one staff will give me a certain treat no matter what Dr. Brown or the rest of the team says. I could be bad all day, and then at 4:00 I get my reward, and then I'll still be bad. And then for the rest of the day, I'm good. So for that whole day, I got my reward, so I'm fine. So you need to be consistent in all those things. So it happens. So when you have it, it's hard. You have to be very patient, and you kind of have to have these things in your mind, like, okay, where did this develop? Is there hope for this person? Can we be consistent? Role models, to be there when it's good, punish when it's bad, and be that consistent and kind of develop a code for that person. And hopefully they adhere to it when they leave. Sometimes they don't, but hopefully we can be some kind of like influence to them that they probably didn't have growing up.
Now, outside of work, what advice would you have for people who may have one of these destructive people in their life? Like, unfortunately, if it's one of their siblings, if they've married this person, if it's one of their children, what can they do?
First thing I would say is therapy. Therapy is available. Therapy is now not taboo as it used to be. There's less stigma. Definitely see if they're willing to go and willing to acknowledge their behavior and change for your benefit. If that person, whether that be a family member or a friend or a loved one, if they're not able to do it and they're being destructive to you and you're feeling hurt, I mean, you got to look out in certain situations for your own health and your own stability. So it might be a case where you might have to distance yourself from that person. It's a hard truth, but you got to see what's best for you. If you're in a situation with kids, what's best for the kids. If you're in a situation where it's your coworker, filing complaints with HR, you got to make changes to the environment because it's not good for you.
A coworker, ugh. A coworker is a little easier because you don't care that much about them, but also you do have to see them every day.
Mm-hmm.
And they can be a little bit, I wouldn't say like go behind their back and get them fired, but I don't know.
I'll keep it 100 with them. Like, there's been times I don't like some of my staff, past and present, have been, kind of reacting to our patients in a way that someone without this disorder, it would be like reacting to someone without a disorder. It's like you have to keep in mind, like, I know you're tired, you might have had a bad day or whatever. I'm guilty of it too. For some days I'm kind of short, or might say, just hold on, like kind of like short with, but you just have to be cognizant and be like, hey, this is a situation. You have to talk in a certain way. You have to hold a certain professionalism, demeanor with each other and with the patient. So I would say face to face, because I mean, with that, like, where you stand with that person knows where they stand with you, and it's helpful. It can help build a relationship if you care. If you're a person that doesn't care, like, get this person out of here, whatever, I would say do those other things. But
it seems from what you just said that if they only care about consequences to them, that the only way you can deal with them is to threaten them, which brings you down.
Yeah. And I've been in that position where I've had to do that. I've had to, I wouldn't say rat out, but I had to, like, this is what happened. I heard about this. Here's a consequence of it. We talked about this. I know I'm not a psychopath because it hurts me when I have to inflict a punishment on someone. When I say punishment, like not having a certain privilege in the unit that they used to have. So that hurts me because I know how hard they worked or how hard they worked to cover up how well they've been doing. And as a result, like, here's a consequence. We talked about it. We outlined it on day one. You wrote the rule. Here it is. But I always give a little hope, like, you got to this point. You can do it again. We're here to motivate you. We're here to help you. If you feel like you're crossing that threshold again, talk to us before you do something that leads to you work. So if you're a person that cares about the coworker or cares about the environment, you'll you do what you got to do to kind of put the consequence down, put the hammer down, but also work on that relationship to build them up. But if you don't give a fuck, then leave the situation or tell them to work on it. If they don't want to work on it, leave the situation. I would say flat out leave because it's going to be bad. It's not going to get better.
That's really interesting. Now, in this book, she mentions that, and once again, I don't know if this has been discredited. As soon as I bought it, I went and looked to see if it had been discredited, and I found it hadn't been discredited yet. So, you never know with these studies if, like, oh, we found this is wrong, and now this is right. But she says that East Asia has lower rates of psychopathy, sociopathy. because they're more socially oriented. You know, like Confucianism. You know, Confucius say, is that racist?
Be water.
No, just be good to your parents. No, saying Confucius say. Is it racist to say Confucius say?
No, isn't that like an idiom? Is that idiom?
I know, but is that making fun of the accent?
No.
Okay.
Oh, well, the way you said it?
Yeah, that's what they say Confucius say. Is that Confucius says?
No, it's Confucius say.
Okay.
I heard that. I heard that before. You're not being racist.
I don't know.
That's how it's said.
Things have changed a lot in the past 2 years, so I don't mean anything. But
I thought you tried to put a little accent behind it, though. I heard it at the beginning, the confused, and then you changed it.
Because that's what he sounds like. He doesn't sound like me.
Oh, it's an audiobook?
No, but in general, you know, the Confucianism, I admire that quite a lot because it's very much like take care of your parents, take care of your household. It's less, it's technically a religion, but it's more how to live your life, what actions are required to live your life well. And if you do all of them, you will have a very healthy life, whether or not you feel it.
Do you know, so kind of what you're talking about, like why there's less sociopathy is in general, and like when I talk to my Asian friends, when I say Asian, like Chinese, Taiwanese, Japanese, in their society, like it is more family oriented, but also like if you honor and shame are huge in that society. So if you're a person that's like dishonorable to your parents or not really living up to your role in the family, the entire society or community shuns you. So it is a lot more hidden stuff that, like hidden outlets. Like if you're angry, you're not really showing it. If you're feeling a certain way, you're kind of suppressing it because you don't want to look bad because it's only not a reflection on you, it's a reflection on your family. And then when you try to go out in society, you can't go far because all society knows what's going on with you. Whereas here in America, we're more kind of getting more tribal almost. Kind of like where we used to be is like cavemen, more tribal, more survival, more id is kind of seeping over here. Yeah, we have our ideals, nationalism and all that stuff, but it's like it promotes division, not cohesiveness. So it's not really social, if that makes sense.
We're individualistic.
Yeah.
It's all about your best interest. And that's how the country was founded.
Yeah.
I don't really have a problem with it because if everyone's looking out for the best interest, theoretically, it should benefit society generally. However, we have seen, especially with clout chasing, that when everybody starts chasing clout at any expense, then it is damaging to the threads that hold society together.
That's a good point. That's a really good point.
So
everyone wants to be that special person, and then social media made an outlet for like, I can be the star of my own show and let's have the world watch it. And that's all I'm focused on. I'm not focused on developing my sense of self. I'm not focused on being individual for the sake of my own development, but for likes and for views and doing what's someone else hasn't done for that purpose and not for my own self-help. So could definitely see that.
Yeah, and a lot of clout chasing is hating on others.
True.
Because people love to hate on others. So you get into that id of using that tribalism and to attack somebody else because they come from the wrong tribe. Even if it's, a child from the wrong tribe, attack them. And, it gets bad. It gets to the point where some Catholic kid is getting $100 million from CNN because everyone jumped on him.
Yeah.
And they turned out to be wrong. And, I'm not defending this Catholic kid or this Catholic. Remember that story? Nah. There was this group of Catholic schoolboys, and they were for fun wearing these Trump hats. And then a native person came up to. You remember that?
Yeah. Okay.
And then they clipped it together. They clipped it together to make it seem as though they were attacking the Native American man when that didn't happen at all. And they got all this hate online. Everyone jumped on them for clout. And then this guy got hundreds of millions of dollars. So, good for him. I'm sure it's the best day of his life, best thing that ever happened to him, because it's like I got hated on for a day and never have to work again, nor do my children. So I guess it's not a very good example.
No, but that's when that's the evil part of it. Like, some people are just looking for the big payday. And me, even though it was unintentional, did he post the picture? Who posted
No,
the picture?
somebody else posted the video, and
Okay.
then people said the worst things about him, and he's like 16. So technically, in our society, that's a child.
Mm-hmm.
And I do agree with that. I think people under 24 are children.
Mm-hmm.
For all intents and purposes, I don't think people should be allowed to do porn until 25. I don't think any of these major decisions should be made because you can't rent
I
a
don't know. The
car.
body's kind of changed around 25. You know?
Really?
Nah, I'm just playing.
I'm just saying, like, I've looked the same forever. Forever.
Black don't crack though.
Yeah, okay, so there's that. So we can't assign porn dates or porn ages by race because that's racism.
But yeah,
We can't say for certain people you can be 18, for other people you
I see what you're saying.
yeah.
Yeah, because about yeah. I see what you're saying, but I mean, that's a whole nother dark. I have dark comments to that, so I don't want to. Yeah.
Yeah, no, that. Well, see, that's another thing that's gotten our societal id has just, kept going.
Yeah.
To the point where I think maybe I wouldn't have this conversation with my grandparents. But if I told my grandparents, who are now deceased, what's going on now, they would not believe me.
Yeah.
They would not believe what is going on in the dark spaces of the internet. They'd say, because I think maybe they were more like those Asian cultures you were talking about, like that will bring shame on everything.
Yeah.
No one would do that. And now it's not uncommon.
Exactly. Like once Trump got elected, everything's out the window. Like that gave power to the id, and that gave power to just more being who you want to be, and don't give a fuck about what other people think. And I can now be who I truly am and let my id out, and don't have to care about the super ego, don't have to care about the consequences or whatever. So now they're running the show.
Yeah, that's
both
interesting. No, that is really interesting because some people hero worship Trump, some people hate Trump, but you do have to acknowledge he was a representation of our id, just saying, I don't care about anything. Everybody, you can see the man behind the curtain.
Yep.
Like, it's all out in the open now. And at least before that, we tried to hide it.
Yeah.
Which, you can make the argument, like, what George Bush was doing was terrible.
Yeah.
And he killed a lot more people than Donald Trump with the Iraq War, illegal Iraq War. That killed hundreds of thousands of people who didn't deserve to die. But we still had the cover of respectability.
Yep.
We said we were doing the right thing and so forth. And Trump just came out and just was too honest. Can we deal with that much honesty?
Exactly.
Maybe honesty isn't a good thing.
Yeah. So sometimes it's like we're learning that Santa doesn't exist at like 5 years old. And prime, we need Santa age. And it's like, nope, Santa's not real. It's like, yeah, we need to learn it eventually, but fuck, I want to live in a world where Santa exists. I want that innocence. I want that. I don't need to know that. And that's what a lot of people feel about politics. Like, I want politics out of things that affect my day to day, because I know it's corrupt. I know all this stuff, but I just know it runs this stuff, but that's not what I'm worried about day to day. But once it imposes on your day to day in your sports and all this stuff, that's why I get when people say keep it out of sports. But the other side, they're not getting the empathic reason why it's in sports. And like, it's, that's the whole thing. It's not part of their culture and Black history and all that stuff that I don't have to tell you about. But that's the mindset that a lot of those people say, keep it out of sports, keep it out of day to day.
No, I understand that. I completely understand why they say it. I don't think they're right, but I understand why people stopped watching football. And they're like, I'm not watching the NBA because it is their release.
Yeah.
From whatever their job is, it's their recreation. They just want to sit down and completely unwind. It's like if you ask ladies who are used to watching the Real Housewives or whatever, and like, should we put politics in Real Housewives? I've never watched Real Housewives, so I don't really know what's up with it. I don't know if it's full of politics, which would be fascinating. But you ask them and say, excuse me, miss, do you want to see a lot of politics in Real Housewives or Jersey Shore? And what are they going to say, you know?
That's true. But, I mean, I would just counter with that as like, hey, must be lucky to be able to just press pause on your day and, not have to deal with it.
Yeah.
When we don't have that luxury.
Yeah.
So that's why it's in your sports, because it's going to affect everything that you do, just like it affects everything that we do in our day-to-day and everything that we do.
Especially when the players are of that race.
Exactly.
Yeah. I don't know, because we have a lot of white crew, and if they came in and they started complaining about some white stuff, I would be like, ooh, I didn't even know about that, you know? Can we work? I don't know if when I try to put myself in the opposite position, you know, like, I don't know, what would like a straight up white problem be? Like beer, IPAs, something going on with IPAs.
Something going, IPA shortage.
Like, wow, that's crazy.
I have to drink half. I hate it. I don't know.
I wouldn't know what to say either. I'm like, can we have a no beer talking rule in the office?
Nope.
I don't know what their problems are, but no, I have a lot of white viewers. We're just kidding. We're just kidding. we don't. I'm sure there are problems on all fronts.
We're not racist. White people have problems too.
Actually, I took that implicit bias test, and I don't think it's true. I don't think it's true because I took it. I think twice or 3 times.
You don't think white people have problems?
No, my implicit bias test. Have you heard about this test?
Yeah, I heard about it.
Yeah, so you can go online, you can take it, and you can see what your implicit bias is just based on the keys and what you associate with good and what you associate with bad. And I'm mixed, by the way. So I'm going to say I can't be racist to anybody at all. Is that true? I don't know. People in the comments are going to get mad, but whatever. I don't think you can be racist.
You could be self-hating to either side.
I am not self-hating.
Or to mixed people.
I hate mixed people, but I am mixed people.
I know some people hate themselves.
I don't.
Okay, well that's good.
I definitely don't.
Okay,
I might have
that's
the other problem. No, but I took it the first time. It said that I was very biased against white people, which can't be true because my favorite person in the world, my little sister, is full-blood white. Mm-hmm. So I'm like, this is a lie. We based everything off of a lie. So I took it again and said I was slightly biased against, it's a European, people of European descent, which could be anybody.
Yeah.
It could be French. It could be Eastern European. It could be Italian. It could be Nordic. I'm like, what are you talking about? Like, and they keep changing what white means. Like the Lebanese used to be white. They took that out. It's not white anymore. So I'm like, well, who do I dislike?
They didn't tell you who you dislike?
It said I have a slight bias against European Americans. But I think the test, I don't think this is a very good test.
Not reliable, probably.
Yeah. It can't be repeated. The results should be repeated.
Yeah.
Like an IQ test, your results are pretty much consistent after a certain age. I mean, you can study a little bit. But like for this test, and then I'm going through, I'm like, maybe it's the way that they ask it. And, you know, I'm not very good at, because they'll switch it up. They'll say, now I means you like, or I means good, and E means bad, and then they'll switch it up for the next round.
Okay.
So maybe it's that I'm not getting the commands or I'm using the muscle memory from the last round.
Oh, so you're literally hitting the keys.
You have to hit the keys.
Gotcha.
And they'll say, do you associate a good word with this person or that? You know, they'll give you a word. So the actual thing is, so I will be, this is a black person and a bad word, or I will be, this is a black person and a good word. And you have to hit that key. And how long it takes you, how long the pause is, that's how they judge how biased you are.
Oh, but they switch up the direction.
They switch up the direction.
That's a confounder.
Exactly. Okay, thank you.
Yeah.
Because I was looking at it, I'm like, there's no way. My little sister is white. I love my little sister. My mom was white.
Yeah.
I am not racist.
Yeah.
I am not implicitly racist in any way, shape, or form. But then the test is like, oh, you're a little racist.
I'm not invalidating the results. I'm just saying they're not reliable.
Thank you.
In both cases, you hate white people. I'm joking.
No.
Me and Maya are joking.
We're joking. We're joking. There's no, and you know what? It might be because this one girl. Does that make me a racist if I just met someone who just bothered me and then I take the test and then I'm like,
it can. We
got to define racism then because this is one person. No. I'm saying I don't trust the test.
Yeah.
I don't trust the test because I should be like right even keel in the middle.
You should go on a date with Tony and like have like the best date ever and then take the test and then go from there.
Oh my God. I can't tell you his test story. Because I was like, you got to take this test. He's like, oh, take the test. And then he took the test and he was like, this test told me anything. It tell you like, and you could take it for different groups too. You could like, do you hate men? Do you hate Asian people? Do you hate Hispanic people? What do you think about women?
Tell me this.
Implicit bias. That's what they have a few years ago. They were talking about like the cops had all this implicit bias.
Oh, yeah, 100%.
Because they had them take this particular test.
Yeah.
And then they
That's
say, oh,
interesting.
yeah. And now I'm saying, I don't think this test is very good.
Doctors should take this test. There's a lot of implicit doctors in the medical field.
You should improve yeah. Okay. You have to take the test like 5 or 6 times and then average it out.
Okay.
Because the first time it was like, you hate white people. I was like, that is not true. I hate them. They're like, you could not hate them more as far as the scale goes. And I was like, there's no way that that's true. But I don't play video games, you know?
Okay.
So I'm not used to, now this command means this and this command means that.
Yeah.
I'm just, that's different for me completely. It was like the first time I was doing something like that in years. And then I felt so ashamed. I felt really ashamed.
They flip the letters, so
then they flip them
yeah,
for the next round.
Yeah. No.
Yeah.
That's a confounder. No.
Thank you.
I don't trust it.
Thank you.
Yeah.
Thank you. Because I was thinking some kind of way about myself. And, you know, my sister's on the group chat. And so I'm like, can I even face her after what this test says? I'm like, no, we shared a room growing up. This is nonsense.
So you hate her the entire time and just didn't tell her?
There's no way. We did. Okay.
How much younger is she?
She's like 2-3 years. We're close. Okay. We're close. We same size. We can wear the same clothes. We're very close. She's probably my best friend now. Like, there's just no way. I have to write somebody about this test. This test nonsense. And so now when I see that, when it says so-and-so has implicit bias because we had them take the test, now I'm thinking, I can't trust your reporting because you didn't go and actually take the test yourself. You're making these judgments off of this test because some psychiatrist or some person says this test means this.
Yep.
But now me looking at the test and me knowing the problems with the test, I say, okay, this test can't be trusted. Yeah. So the basis of your whole article can't be trusted. And then other people will take that article and take it to mean something else. And it'll just snowball. But I'm like, well, the very basis is wrong.
Yeah. Agreed.
I don't know what to do.
That's what it is. Everyone's just trying to be the first, and everyone's trying to prove their point and win an argument. So in any way you can do that, oh, yeah, I have this new test. Oh, let me take the test. Oh, have this important person who we hate take the test. Oh, yeah, they fulfilled our agenda based on our argument. Let's put it out there. Let's do all that. And then it's a retractment. Oh, yeah, I'm sorry. We didn't mean this, and it wasn't reliable, blah, blah, blah. If you get that, some people or some organizations are like, nope, we'll run with it. Just keep going.
I have no trust
We never
in
said
the
that.
news. Yeah. Well, because... And I'm gonna do a video. I haven't done it yet, but I started off as a journalism major, and then I switched because I was like, this is nonsense. This is absolute nonsense. And I switched to a different major. I switched to history and sociology, so I could actually go through and study and be like, oh, okay, I see where this is nonsense. Because the sociology will tell you, oh, okay, this is where it is. This is where the stats are. This is how you properly read stats. And then history is sort of like, okay, this is how it's played out over peoples.
Yeah.
But the journalism major, which I got like a few years into, and then I was like, I might as well just do history because history is just accurate journalism over time. Okay, so in the book, The Righteous Mind by Jonathan Haidt, so why good people are divided by politics and religion. So he says that we all have a moral mix. So we have 6 things that mix together to form our own morality. And he says those things are care harm, which is providing welfare to others. These are the social safety net.
Okay.
Liberty oppression, which is what our country was founded on, that we should be free to do as we please, as long as it doesn't hurt others. Fairness, cheating, which is pretty straightforward. We all want to be fair. All sides want to be fair. Loyalty, betrayal, which means you're loyal to your spouse, you're loyal to your friends, you're loyal to your tribe. You're loyal to your religion. Authority, subversion. So we respect the hierarchy. Hierarchy will be a word on Wording is Hard coming up. Hierarchy.
Yeah.
The order, the social order. And then sanctity, degradation, which is, do we hold things sacred? What do we hold sacred? And do we hold anything sacred? And what he says is that liberals lean more towards the care harm, fairness cheating, and the liberty oppression, while conservatives are evenly distributed among all 6 of those values.
Okay.
For people at home, if you want to test yourself, you can go to yourmorals.com and be careful because your morals might not line up with your party affiliation. You might turn out to be a black conservative, which apparently is the worst thing you can be.
Yeah.
I didn't know this until I saw Uncle Tom, and then I was like, oh, is that bad? Is it?
Yeah.
Did you see that movie?
I didn't see the movie.
Oh, okay. Yeah.
Yeah.
I don't know if you have
There's
to.
a Key and Peele skit that talks about that too. It's pretty funny.
Yeah?
Black conservatives, they have like a meeting and they're all dressed the same and they're saying all the same like jargon, and it's pretty hilarious. You should check it out.
Hey, liberals say the same stuff too. They got the talking points.
Yeah, that's true.
They both sides they have what they're supposed to say.
Yep.
And if this conversation goes outside, they just bring it back to a talking point. They're always like, bring it back to a talking point because we can defend the talking point.
It's ridiculous. Yeah, I mean, I can see that. I need to take the test. I'm gonna be honest, full transparency. I didn't take the test. I wish I would have, so I could prepare, like kind of back what I think. But I feel I don't really value the loyalty, betrayal, sanctity, degradation point of it. And I'm a Christian, so it might seem counterintuitive, but in terms of like society standards, you can't be 100% loyal to some other person. They're ultimately going to do something that might conflict with you or conflict with your values or conflict with your family or something. So I wouldn't necessarily call it betrayal if you're not 100% backing that person, but I don't know. Loyalty comes to an extent to me. If it involves like breaking the law or something like that, I'm not going to do that. And then sanctity, degradation, we should be a society that always improves on things. I think that there should be better versions of us, better versions of values that we hold dear. But like our society should continuously improve, which this is what it was based on. The Constitution was supposed to be a living document. It was supposed the amendments and everything. We're supposed to get better. So there's certain people like what are they called? Originalists, like some of the Supreme Court justices rule on originalism. Judge Scalia, who passed away, was one of the major proponents of that mindset. Basically, I want to do and rule on what the founders meant. So no matter what, the founders are the baseline, and we're going to rule based on that. That doesn't make sense. It was a different time, different circumstances. To me personally, that doesn't make sense. But there's certain people that hold up certain values, certain figures, and certain events. And if you deviate from that and the results from that, then you're degrading them and and they fight against it. So I can definitely see all six for more conservative. I have conservative values when it comes to money. Besides that, maybe I would say I'm more liberal. I don't mind paying extra tax. I don't mind doing all this stuff to help my fellow man. I would think my actions kind of support that. But some people, again, care about themselves or their tribe, their family, and, that's what is valued more.
I was surprised. I was surprised when I took the test.
You're concerned? Well, you don't have to tell.
No. I'm not conservative. I'm more conservative on some things and more liberal than liberal on other things. Like the sanctity one, degradation. I was much more conservative than conservative on that one. Yeah, because here's a story he asked in this. Because he asked these people from a small town in Brazil, a city in Brazil, and then Philadelphia.
Okay.
So he asked them these sort of morality questions. And he says, is it right or wrong? Just tell me if it's right or wrong.
Okay, I'm ready.
A man goes to the grocery store and he buys a whole chicken.
Okay.
Takes the chicken home and he has sex with the chicken. Is that right or wrong? What's your gut? And then tell me later.
I'm going to say wrong. Mm-hmm. The reason why, if I want to put it, there's different views you can look at it. From an empathy standpoint, if I was the person, which a lot of people would probably think, no, that's dirty. I would never do that, so that's wrong. So no. From a societal standpoint, that's bestiality, which is illegal.
The chicken's dead. He didn't buy it alive.
Dead?
The chicken is dead.
It's necrophilia and bestiality. I don't know. A lot of people that would say, oh, it's bad are putting themselves in that position. So they're like, no. But if you're thinking about it as society, it's not technically wrong. But I say it's wrong. But it's technically not wrong. I would say it's wrong, though.
Yeah. Now, here's
Definitely
the thing.
wrong.
He didn't hurt anybody. He didn't hurt any...
The chicken wasn't able to give their consent. So.
The chicken is dead. We could eat the chicken. Why can we eat the chicken, but then he can't do this with the chicken?
Because what's the like? Is he getting off? Like,
yeah.
Okay.
It's the same thing with the id. It's like eating and yeah.
That's true. I have the weakest defense of this argument, but I'm just going to say it's wrong and the defense rests. That's all I can say.
Yeah.
I have no argument against that.
Yeah.
Technically, you're right.
No, I also am against this. I can't. He shouldn't be arrested for it, but he can't date my sister. He can't coach my kids. He can't live next door.
Yeah.
But he shouldn't be arrested for it.
Yeah.
So that's where I'm at in this.
So if you're a society that learned of this behavior, would you require this person to make this information public? Like someone who's like unequivalent of like someone who's a sex offender and they have to like register and like kind of notify the neighborhood. Would you do the same thing for this individual? Because how would you know unless you personally found out?
If I looked through my window and I saw my neighbor doing this, I wouldn't eat at his house. I wouldn't take any plates of food he gives, you know. So I don't know if I'd make him, because it's messed up. We're in America, and you can do whatever you want in America.
Yeah.
However, and I can't explain it, I know that's icky, and he shouldn't do it, and so I'm so icked out by it. And this is where the sanctity degradation thing, this is where I scored so high on that. I'm just like, ew, no. Okay. I'm not saying you should register, because that's pretty extreme.
It's very extreme, yeah. But like, would you take an active position like, oh my God, my neighbor does this. Let me let other people who might live around us know that.
I'm telling everybody. I'm telling everybody he did that. Okay. Everybody knows.
So okay. So that's probably why you're high. Is that right? That part of it?
I mean, and it's like if I looked through my door and I saw my neighbor having an orgy with like 20 consenting adults, I'd be like, okay, well, that's what he's doing.
Yeah.
That's none of my business.
Okay.
For some reason, that is none of my business. If that's what he wants to do.
In actuality, if you think about it, that could possibly have more effect on you compared to the chicken thing. Because the chicken, he's not going to mess with you. It's a chicken, but he might come up to you and be like, hey, you want to come to the orgy?
I'll say no.
Okay.
I'll just be like, no. He can ask.
Okay.
You're allowed to ask. And I say, no, I'm not interested. But, you know, I'll see you at the barbecue later, the block party. That's fine.
Okay.
I'm okay with that, but something about that, and this is what he brings up in the book. He's like, people couldn't tell him why this was wrong.
Yeah.
They just knew it was wrong. And then people from the lower classes, the working classes, looked at him like he was crazy. Like, what do you mean? No, you can't have sex with a chicken. But the people from the upper classes were more likely, in both places, across country, to say, no, there's nothing wrong with what he did.
Interesting. So, wait, the people from higher classes said there was nothing wrong, but the lower class said, yes, that was wrong?
Mm-hmm.
Interesting. Why do you think that was? Did he explain it, or you just left it open-ended?
He left it open-ended, and I actually want to ask if I can ever get in touch with him somehow. I'm like, do you think there's something about people being less moral that allows them to achieve a greater status? Or do you think it's that status is training of their youth, which says, let bygones be bygones, live and let live?
I would say the first point, personally, because in order to, and this kind of goes into the psychopath discussion, in order to truly be excessive in your worth and your value and like CEO, you got to not care about people lower than you. If you want to be billionaires, but like you're a billionaire at Amazon, but your people that work at the factories don't have a living wage, that requires a level of not giving a fuck about the people that work for you. You could easily pay for their wages. You could easily pay for their health care. You have an excessive amount of money, but you choose not to. More money than you'll ever spend or your kids' will ever spend, but you choose not to. So to me, that's a moral question. Because true morality, I have the means to provide for so much in society, yet you're trying to advance society, which is good. But again, that's a personal gratification thing. That's a goal that he has. But it's like, it's so much fucked up stuff around. Education's fucked up. Infrastructure, homelessness. I can literally solve homelessness with a quarter of my worth, but I'm choosing not to. Trying to build a rocket ship to go to the moon.
Yeah.
Because I want to be that seen as that person, possibly. I don't know him, so I can't really speak about him or his intentions, but you know.
this is why this past year, especially after lockdown and the billionaires getting more billions, and then I see what the red team is saying, and they're saying, these people have all this money and they're treating people this way. And a lot of them are on the blue team. A lot of these tech CEOs are on the blue team, and they have all the money in the world, and they're spouting out these ideologies. But then when you scratch the surface a little bit, they don't believe them.
Yep.
Whereas a lot of the people on the red team are small business owners, and, they put their money where their mouth is.
Mm-hmm.
So this past year has had me thinking a lot about this sectarianism, this tribalism. I'm like, is the red team that wrong? I know from your morals test that I'm not on the red team, but I'm like, you guys making some good points sometimes.
Yeah. A lot of times we're spending all this tax and it's like, where's it going? And it's like, it's not helping me personally. It's helping these agendas. And I don't want to spend money on all this tax. I want to keep it and I want to help me and my family. I get it, especially if you worked so hard to get it and now you're just releasing, 40% of it in this state. I get it. I can see why.
You know what? A lot of these people, these billionaires that happen to be on the blue team, they're paying way less in taxes.
Yeah.
But let you owe the IRS $70. They'll come for their $70.
100%.
But for $70 million, they're just like, okay, whatever.
Yeah. It's an institution. That's why it's like, yeah, sociopaths out here, but, attack these institutions. I mean, I don't know. That seems like that's the only way to get change is to kind of like buck the system. Or it's going to happen very, very slowly, if at all. It might actually get reinforced. Who knows?
Yeah, it seems to be getting reinforced because they're getting rewarded. There's no consequences.
Yeah.
So, I mean, at one point, is society just completely taken over by everyone's id? And it just, honestly, I don't think it'll crumble because we have so many things. I think it'll just keep going on, getting worse and worse for a long time.
So you don't think it'll ever reach a breaking point? Because, I mean, every great civilization kind of plummeted.
After
Roman
a long time. Okay, so the Roman Republic fell, and that's what we all talk about. The Roman Republic fell, and that fell with Caesar.
Yeah.
So that fell when Caesar crossed the Rubicon and they stabbed him, and whatever. So that's the fall of the Republic, and that's where everyone is thinking where we are right now. But the empire kept going for 400 more years, and some people were like, maybe the empire shouldn't have adopted Christianity. It made them soft. Because, Rome in its heyday was not soft. Rome kept going because whatever it did, it didn't care. It's just like, genocide these people, steal this land. We're doing it because we're Roman, and the best thing we can do to other people is to make them Roman, so it doesn't matter what we do. It's a wonderful colonizer attitude. I can't get my mind around it, but also I didn't grow up with those kind of stakes, life and death every day.
Yeah.
That the ancient peoples grew up with. So I'm more than happy to say I just don't understand what they went through. But yeah, the Roman Republic fell, and that, I don't know. I don't know if we're at that point or if we can even compare it to what we have. But the empire kept going in a very dark way, a shadow of its former self, for hundreds of years.
I didn't know that.
And then it kept going in the east because they split the empire because they're like, it's too much to govern. So they kept it going in the east for hundreds more years. So when people say Rome fell, I mean, Rome took a long time to fall, start to finish, to go from the monarchy to the republic to the end of the empire. And then that was a long time, many, many of our lifetimes.
Wow. I didn't know that.
So everything will fall eventually.
Yeah.
But are we talking 500 years? I did a video on accelerationism where people are like, well, if we just make it as bad as possible, eventually it will collapse. I'm like, says who? Based on what? What is your evidence that it's going to collapse? We have all the food. We have all the military. We're going to be fine.
Yeah.
Like as far as our basic needs, as far as that we have something to eat, we have a roof over our head, and nobody can attack us.
But what about where we're going now, where we're attacking ourselves, and then in the midst of that, our enemies capitalizing on that?
A house divided. That's what Lincoln warned us about. It's like no one's gonna invade us. It's just the geography is such that it's not going to happen. But we could tear ourselves apart, and if we're going to do the Rome comparison, we could decide, okay, we're going to break apart into different, blocks. And I mean, that's interesting, but I've always been against that. I haven't always been against that, but I've recently decided, not recently, like a couple years ago, I was like, I'm against that because how long before we're just at war with each other? Like straight up at war with each other. So let's not break apart. Let's everybody deal with everybody. Because the North and the South are just gonna be like, all right, doing it again. And it's like, no, we're not.
Round 2. Let's go.
No, y'all need to chill.
Callie, don't know what team you're on.
Oh,
because you do both. So I don't know.
Yo, Callie is, and this is probably something that's not going in, but this past year has taught me a lot about, these are the limits of what the blue team knows.
Yeah.
The blue team is not managing this stuff very well.
Not at all. Not at all.
We let them. We're like, okay, you guys can have a liberal paradise. And then what happened? Yeah. Now we look stupid. Now we look so stupid. Red team's like, well, look over at California. I'm in California like, yeah, man, there's a lady taking a crap on the sidewalk down there. The CVS, the CVS in front of Target on Victory?
Yeah.
Okay, it started off with 110. Then it was 210. Now it's all the way past the dollar store. It's gotten out of hand. I'm like, this is chaos.
Yeah, downtown's the same way.
You live downtown.
Yeah.
Can you tell the people what downtown is like?
Downtown is, it's first of all, a lot of the businesses are boarded up at night because they're worried about rioters. Skid Row, still Skid Row, but it's expanded way past into like Silver Lake Echo Park. So they recently put up fences to like kind of displace the homeless that are now living there. But Echo Park, there's a big lake right in the middle. It's right next to downtown. Like you were saying, 1 tent, 2 tents, but now an entire side of the lake is covered in tents. The entire side. But they're just now trying to remove it on order of the mayor.
Yeah. And I don't want to seem mean, but I'm like, that's public property.
Yeah.
You can't live on public property because it's for everybody. It's not for you to pitch a tent. It's for a family to have a picnic, then take their stuff away, and then another family comes and has a picnic.
Yeah.
It's not for you to just be there all the time.
But they're being just displaced. Like, that's the thing. That's what we do. We don't build stable housing, which we have the money to do. We don't do that. We don't provide stable food havens for the homeless. Instead, it's just like, oh, you can't be here. They get to another place. You can't be here. And they're just pushed and pushed and pushed, and they have no place to go. So then they just congregate in parks because it's like, oh, there's all this land. There might be a couple people patrolling here and there. I might get kicked out here and there, but it's clean. Mm-hmm. There's not a lot of buildings around. There's a public bathroom. So it's like, where else can they go? It sucks. All you need to do is build stable housing, and we have the money to do it.
Because they keep asking us these propositions. Do you want to set aside like $1 billion? And every year we put, I'm like, how many billions have we set aside?
Exactly. And they're just building up like a couple here and there. That's the big issue. And that goes to your point. Like, yeah, we set all this money, we pay all these taxes, but where's it going?
They built a tiny home village in North Hollywood, not far from me. So that got rid of the one that was on the bike path. There was a small encampment starting to grow. So I think that's where they went. Mm-hmm. And I'm totally for the tiny homes because if someone sets their tiny home on fire, it's not going to set up the whole building. Whereas if you have an apartment complex where you put them all in, mm-hmm. and one of them isn't in their right mind because they're high or they just they're forgetful, and they leave the stove on and it starts a fire that takes up the whole building. Mm-hmm. So I'm very literal, like, okay, you can have a tiny home village and it's not going to catch everyone on fire.
Yeah.
I know it's a super simple solution, but...
Hey, it works.
And they're going to build another one. And I don't mind these tiny home villages because...
Sadly, you're not, I wouldn't say minority, but not a lot of people feel your way because simply the conundrum that is California. We pay all this money, and what we want is if we own something, if we're renting an apartment, we want it to be low rent, so it's good for that. But if we own a home, we want the value to go up. So if you're just putting all these homeless people in that neighborhood and building tiny homes, they're going to think, oh, my property value is going down, or an unsavory environment's going to come up and creep up. So, again...
And they're not wrong. It's going to bring the property value down.
Yeah.
They're not wrong about that. It will.
So, I don't know what to say.
I don't know what to say either. I can't afford a home.
Yeah.
You're a doctor. You're
I'm
having trouble.
barely. Yeah. It's crazy out here.
Yeah. So
Yeah.
you are a doctor, married to a doctor, and you are
Yeah.
still having trouble affording a home in Los Angeles.
100%.
So
At the edge of our budget. We just went into escrow in a house and we're waiting, but edge of our budget. Barely.
I'm
And
not
struggling
gonna-
for that.
yeah, how many bedrooms?
It's going to be three beds.
Okay.
3 bedrooms. 1, 2, 3, 4 bedrooms.
That's
3
a
baths.
minimum because you have family that's gonna come to visit.
Mhm.
You have a baby on the way. There's probably gonna be another baby on the way.
Possibly.
Yeah, I mean that's how many bedrooms you need.
Yeah.
Okay, the last thing we're going to talk about
Okay.
about morals.
All right.
You ever watch Catholic YouTube?
You did put up. Yeah.
Okay,
No, I haven't.
okay, you gotta watch Catholic YouTube.
What
You
is-
gotta get on Catholic YouTube because
Okay.
there's a whole section of YouTube that is just their monks, friars, priests, exorcists.
Interesting.
Exorcists. So they legit believe that demons can possess people.
Okay.
And this can be the cause of a lot of destructive behaviors. So it's not the person itself, it's something coming in and possessing a person.
Okay.
So if someone were to come up to you and say, Dr. Donald, I think I'm possessed by an evil spirit that's making me act in this way. What do you say?
So, personally, as a Christian, I mean, the whole concept of demon possession is like a fringe subject in our religion. I'm not going to say I believe it, but I'm not going to say I don't. I don't really know that area. It's enough to say, like, oh, no, you're lying. But to your point, I did have a patient before who said that, who basically said, oh, yeah, all this is due to a demon. All this is due to that. So I inquire about it. Tell me everything about it. Tell me everything that happened before you were possessed, everything in the midst of it, after, while observing that person. So in my personal experience, it was false because they were just using it as a means to kind of explain their kind of shitty behavior to other people. Kind of the whole sociopath type thing that we talked about. So my personal experience, I look at everything. I look at all the factors. I'm not just asking questions based on what you say. I'm looking at how you were before. I'm looking at how you are after. A lot of times when I evaluate people, actually not a lot of times, every time I evaluate someone, I'm talking to people who know them. I'm seeing literally how they are minutes before I talk to them. So I'm like observing them. And then I'm talking to them, and then I observe them a little bit after they leave. So I'm using all that information just to like make my opinion. So same thing with the demon thing. I'm asking about all that stuff to see if it's consistent, see if they really did act a certain way, because there is a mental disorder called dissociative identity disorder, which is what they know what is multiple personality disorder, where basically you're taken over and it's usually rooted in trauma. And you have a distinctly different personality, but you're not able to identify it. That's usually the main separator for someone that has a disorder. So you're in this different trance state or this different personality, but you're not aware of it. So someone that says they're aware of a demon possession, I rule that out. I'm talking about all that stuff. But I don't know. To me, personally, I think it's BS, just from my personal experience. But to answer your question, I really can't give an answer. I really don't know either side. But I've had that a lot of times, people saying I was possessed, but ask all those questions and I'm not able to give reliable answers. Because if that happened to me, I could tell you everything that happened. I can tell you, all the stuff that you would want to know, because I would want that help and I would be scared doing it. So I need to see that also.
Do you think that when they do this, they want attention from the priest or the families?
Can be possible. I mean, with my experience that I talked about, it was more so this was it's kind of like someone who I'm giving terrible examples today, but someone who's like going to a party, they drink, get hammered, they act like an asshole. What would you think in that situation? They have two things. One, oh yeah, that's not me, I was just drinking. And secondly, oh, don't blame me, it was the alcoholic version of me doing that. So it's like a built-in excuse, essentially. And it's an excuse to kind of be disinhibited. So disinhibited, like not really caring what other people say, you can let loose, and then it's like, oh, I gotta just fall back on this excuse. It was the demon that made me do it. So kind of that's the mindset I have when someone tells me, oh yeah, there's a demon. Okay, Tell me about it. Tell me how you were before it. Tell me what happened in the midst of it. Oh, this all corresponded with you doing this certain thing, and it's because the demon happened. Okay, what made the demon leave? When you stopped doing the bad thing, the demon just left. Okay, tell me more about this. How do you know it's a demon? What, like, so you're gonna ask all these questions, and depending on the consistency of it, depending on how they are before and after, that would kind of answer the question for me. I personally think it's an excuse. I don't think it's something that's real.
So according to Catholic YouTube, you can tell if the demon has left or not. The person can't hear the prayer, the Lord's Prayer, or holy water will help a lot.
Interesting.
Because they can't stand the holy water. So they'll be like, oh, the demon will be like, oh, I left. And then the priest will be like, oh, holy water. I'm like, ah.
Do they actually show exorcisms on YouTube? Or they just talk about it?
I didn't see one on YouTube, but I did see one on Netflix. It was a documentary of the Italian priest that the exorcism was based on. I can send that to you.
Yeah.
So a lot of these are very mild possessions. Like, they're not going out and killing people. They're just kind of acting up a little bit. And I'm like, it's got to be something like multiple personality disorder.
Yeah, possibly. And it's just under the guise of that.
Mm-hmm.
And it's usually rooted in trauma. So I would ask about that history. Like, and trauma can be physical, emotional, but even neglect can manifest as trauma. And like you said, acting out as a means to get attention. And this is the result of that. And it's like, oh, let me make up this entire character to get my whoever I'm trying to get attention from's attention. So it's possible. And that speaks more to like the tendencies we talked about, like psychopaths, sociopaths, trying to do what you got to do to get a response. Possibly.
That's interesting. Did you see the movie The Devils of Loudun?
The Devils of Blue Dawn?
Loudun.
Mm-mm.
It's a historical documentary, not documentary. It's a historical drama based on a real story. But basically, it's just these nuns who they go mad, and they say that this priest, who was they make him look good in the movie. But really, when you look at the history, like, this guy had knocked up somebody's daughter. He was a terrible priest, you know?
Mm-hmm.
I mean, he might have been good at reciting the scripture, but he was not a good man. And that I was just using that as an example of back in the day when people said that they were possessed. It used to happen all the time. These women would say that they were possessed or whatever. That was multiple personality disorder.
Possibly, yeah.
Possibly.
Yeah. Could be. What behaviors did they exhibit?
I mean, like you said, it was an excuse to be disinhibited.
Okay.
So sort of go wild, and they're nuns, so they're very just stay in prayer, stoic prayer. And then this was an excuse probably to just let all of those suppressed sexual desires just go free.
Interesting. Did they ever like revert back? Did they ever remember what they were doing when they weren't acting like nuns?
I'm not sure. Honestly.
Because it could just be, like you said, the excuse, but it's like this person who we held to such a moral standard is acting in this way and saying it's okay to do it. So now I have the ability to do it. Almost the same as like our past president doing that same thing. And now it's socially okay to do this in public. So it could be that as well. Not necessarily multiple personality. It just could be like letting loose because you just don't have the ability to do it at all because it's just repressed and suppressed. So it's like, now we have permission to let go. Let's do it. Let's all do it together.
They killed the man. They burned him at the stake. So
shit.
I'm not sure what the history is, the actual history, not just the movie, of what happened to the nuns after they burned this man at the stake. But what you were saying before, if it's socially acceptable to do this, then it's not strange, right? If society gives it the okay, then
it's okay.
It's whatever goes, right?
Mm-hmm. Oof. Yeah. If there's no consequences for it, and it's like, oh yeah, you're good. Da-da-da-da. Go about your way. It's like, okay, cool. I can keep doing this. I have permission to keep doing it.
So there's no absolute morality.
I would say no. It's fluctuating. I mean, the only absolute morality is like, don't kill. Don't
But
rape.
not in war.
That's true. That's true. Don't rape. Don't. That's probably only one, really, if you think about it. But what we say are absolutes, day-to-day absolutes. You shouldn't lie, but yeah, there's white lies, stuff like that. But yeah, I would say it fluctuates just based on the society. If you live in a lawless society, normal is being lawless and not following rules. If you live in a society that's very intact and very strict, normal is staying within that. And abnormal or weird is pushing the boundaries, or, hey, this is too strict. Let me go a little bit past this. That would be considered weird. Like, why are you not adhering to the strict rules of society? Why are you trying to make laws in this lawless society? You're weird. You're weird. It's like you're going against the social norm. To a point, like, because certain people try to act weird, but it's still normal. It's just like, oh yeah, they're just expressing themselves. They're good.
They're acting more to be normal.
Yeah.
It's normal to be weird.
Yeah.
Okay.
And weird meaning not conformist type attire, conformist type appearance. Now weird is like we talked about the hairstyles, the hair color, the way to dress. Like, to me, I would, like, the way I'm dressing now is actually very formal when I go to work. When I go to work, I wear hoodies and jeans and stuff like that. And that could be considered weird. I wear my hat I always wear is what I wear to work, what I wear in front of my patients. To the point where, like, other doctors are like, oh, were you on call last night? I'm like, well, no, this is just how I choose to dress, but thank you. So kind of changing it up. It's considered weird, and I know probably behind my back they're saying it's weird, but, like, I'm comfortable in it. So hopefully maybe that becomes a new normal, and I've actually seen other docs kind of dress in jeans and kind of dress down too, which our work allows. So maybe it's not weird because they're allowing me to be myself within this normal environment without kind of questioning it, or just there's like little things here and there, but it's not really weird. Weird would be if I wore like shorts and like a basketball jersey or something just out of nowhere to work. That would be weird.
And it would be weird if you dressed in a 3-piece suit.
Yeah, because it's like, yeah, you normally don't do that.
Yeah.
It's normal within this setting, but you as a person in this environment don't do that. So that's weird.
So if somebody shows up, doesn't usually wear a 3-piece suit, they're wearing a 3-piece suit.
Yeah.
Are they possessed by a demon?
Possibly. Because then they're going to ask you, hey, what's going on? Why are you acting like that? I don't know. It's this demon inside me telling me to dress nicely and to have this cane and monocle. I don't know. Who knows?
Okay, this is completely unrelated. This is the last time I asked, and it's super stupid. Okay. If you had a patient,
yeah,
and they said that they're possessed by a demon, and the demon is telling them to be a good citizen and do all these good things, but you know this person is out there is no demon, but the demon is a very good influence. Do you let that person slide? You're just like, you can go back to society with your demon?
So to answer your question, I do have a patient like that, similar situation, but it's not a demon. This patient here is an entity. This entity is telling actually a couple patients. This entity is telling the patient to love everyone and, you know, to be well and just love, just general concept of love. But this same entity also tells them to harm people or harm themselves, to the point when they came to the hospital, they're actually in the hospital for that harm that the deity told them. So in psychiatry, it's all about a spectrum. So if the deity is still present, cool, as long as it's telling you not to hurt other people, hurt yourself. So I'm fine with that situation happening if they're not hurting themselves, hurting other people, and it's consistent throughout the time they've been there. It's cool. Let's keep it going. And it's not influencing other things like their eating habits, sleeping, bathing, all that stuff. Because we look at all those factors before we send someone out. So if they're able to live their life with this unseen entity kind of telling them things and they're not bothered by it, they're not like distressed by it, that's fine. I don't think that's something I can keep them in the hospital for and take away their civil liberties of living life because they have this thing that's a part of them. I just get concerned when that other stuff happens. So, yeah, that's our goals for treatment. You're going to have this illness as part of you. You might have certain symptoms, but we don't want you to hurt yourself, hurt other people, and you got to take care of yourself. If you're able to do that, you're ready.
Nice.
So, that's what we do.
That's really interesting.
Yeah.
Oh, my God. Will you please come back?
Yes.
Okay.
Thank you for having me. This is fun. I love this.
They're going to love you. They will.
And this is how I am with all the time. Like this is how I am with my patients. Like, you know, This is how I want doctors to kind of be, kind of informal, laid back, shoot the shit. I like this. So thank you for having me.
Thank you for coming.
Yeah.
Dr. Donald and morality. Okay. Bye, y'all.
Peace out.